questions people may have. All right, so just give me a second while I share my screen. Just trying to swap the view so you can see the slides a little bit bigger. Think it's okay?
Yeah.
Maybe. All right, we'll just go here. This is blocking it, that's why. All right, so first we just want to kind of start with the current status in Atlantic County. So here we have our peaks along the way for Atlantic County, and we know that we had the biggest peak earlier this winter, back in January, February. We then again had another surge in late August through September and October, and things were declining till the past few weeks here in November. So our current daily new cases is 22.4 per 100,000. Once you get to that 25 number, that's considered high. So we're kind of in that high moderate right now, not very high transmission. Our infection rate is 1.04, which means slightly more than one person is infected for every infected individual. And our positive test rate is 6%. The Delta variant is by far it's the gold bar here. This is a picture of all of the different the variant strains by week, and we can see that we have been dominated by the Delta strain in New Jersey for quite some time. This is a graph that shows our COVID waves of inpatient hospitalizations here at AtlantiCare. So we see our beginning surge at the beginning of 2020. Then we see our late December to January, February 2021, followed by a lesser surge in the spring of 2021. And here we are right now, we're kind of at a plateau. So you may hear or see in the news that some are saying, we're kind of plateaued at some high rates of transmission going into the winter months. So we're just watching very closely as we go into what's typically coronavirus season, typically a season when people are indoors and there's holidays, and we still do have significant rates of transmission occurring in our community. Here's a graph that shows three different kind of projection levels of COVID in the United States. So worst case scenario would be a peak right after the holidays like we saw last year. But most models agree that yes, there'll be a slight uptick, but nothing like we saw in previous waves. We just want to make sure that everybody has the correct information that they need. Certainly when we're talking about vaccines, there's a lot of opinions and there are facts, and it's important to separate fact from opinion and to get your information from trusted resources. So I like to always include this quote from the World Health Organization director. We're not just fighting an epidemic, we're fighting an infodemic. This is an article that was published in Scientific America or Smithsonian Magazine that actually has some really good tips for how to kind of go through information and discern what is reliable and accurate information versus what information may not be something that's reliable. And it goes through basic methods of scientific research. Some good COVID-19 resources are CDC, World Health Organization, New Jersey Department of Health, American Academy of Pediatrics, and peer-reviewed journals such as the New England Journal of Medicine, the Journal of the American Medical Association, the Lancet, and Nature. So I want to turn it over to Dr. Trivedi to talk a little bit about SARS epidemiology in children.
Thank you so much, Gemma. So really a brief summary of the epidemiology in children, and we would classify that from ages 5 to 11. Although children are least likely, or less likely, I should say, to get infected than adults, there's still a significant amount of reporting, about 1.9 million reported cases. That's a significant amount. Infections in children, again, are less likely to be reported than they are in adults because the symptomology is sometimes less. And so they don't end up getting tested as frequently, unfortunately. We are seeing an increased uptick in hospitalizations, of course, especially in October, we saw an increased uptick in that as well. Cumulative hospitalization rates were increased as well. Pre-pandemic compared to the pre-pandemic influenza seasons. There has been a lot of different kind of syndromes and concerning like symptoms. And I guess Dr. Ma and I can kind of go through that if there are questions regarding that, regarding children. But for the most part, symptomatically, they tend to do fairly well. Although post-COVID syndrome is a very real thing in children. And so children do report having post-COVID like syndromes, long haul symptoms, if you will. And that's concerning. Some individuals and children, especially young school-age children, end up spreading to households as well. And so it becomes more of a vector of infection to those individuals who are immunocompromised or have underlying conditions. So it's really important to identify those children who have been infected sooner. So the question always comes up, why be vaccinated at all? Especially if I just said that children's diseases typically are milder than adult formed diseases, do children necessarily need to be vaccinated? Vaccines are certainly effective against severe disease and death, especially from the variants. The vaccines, all three of the vaccines have shown to be phenomenal against hospitalizations and against severe illness, specifically death. Although vaccinated individuals currently, and what we would consider vaccinated individuals, it's those individuals who have completed a series of 2 doses. We are seeing breakthrough cases because immunity does wane. Typically, that immunity wanes at the 6-month mark, and those individuals can get breakthrough cases. Those breakthrough cases oftentimes are milder, and vaccinations still prevent severe illness and hospitalization, but you can get breakthrough infection. That can be debilitating to certain degrees. It can prevent you from going to work, all sorts of other issues with that. A very key kind of slide here from the CDC is that the Delta variant, which is the most common variant that we're seeing in the United States, what fully vaccinated individuals, how you can reduce your risk. You're 5 times less likely to get an infection. You're greater than 10 times less likely to be hospitalized, and you're greater than 10 times likely to survive without mortality. And so that's a really important slide, the 5 times less likely to get infected. So I want to kind of harp on that. Is the key is if you're vaccinated, you're 5 times less likely to get infected. Although if you are infected, you can still spread equally, just like someone who is not vaccinated. So it has that benefit of protection there. But the other key stats, of course, is you don't have to come see any of us in the hospital, which is important. So as far as vaccines that have been approved, the Pfizer vaccine currently is a messenger RNA vaccine approved for children 5 to 11. It's a third of the dose. 1/3 of the dose is approved for children who are 12 and older as well. It's a great vaccine. It's a 2-dose vaccine series. This technology, messenger RNA, and I've mentioned this previously, has been around for quite some time. Many, many years we've been deploying this technology for chemotherapeutics in immunocompromised patients. Although this is the first time we've used this technology for a vaccine, it's proven to be highly effective in creating antibody responses, as evidenced by all the information. So as far as during the meeting, and this is the kind of the research that broke down the approval for this, they did a randomized trials and phases. They compared it to placebos as well. And what they found is the efficacy of the vaccine with lab confirmed COVID-19 was roughly around 91%. That's excellent amount. You had only 3 cases in a vaccine arm and then 16 cases in a placebo arm. And so it showed really significant amounts of I guess prevention. When you say 90% effective, it's 90% effective against all of those metrics we mentioned earlier. As far as adverse effects are concerned, there were some adverse effects. There were no deaths in any of the trials, so that's really the key factor. Some individuals did experience pancreatitis, abdominal discomfort as well. Some people had some swelling of the joint, but other than that, there was nothing significant. I know myocarditis is something that's going to be brought up, especially questions about that in children. The Pfizer vaccine was really excellent against demonstrating myocarditis as well. And then as far as this local reactions, individuals ended up, this is very similar to what you would get with other vaccines as well, influenza included. If people who got the flu vaccine, very similar effects of local reactions, redness, pain, swelling at the injection site. Some individuals experience fevers, nausea, and vomiting. And this, unfortunately or fortunately, it's very common across the board with other vaccines. When compared to a placebo, it was slightly higher than a placebo group, but still very, very low amounts of individuals had that, around 2.7% of children that were studied.
Dr. Ma, I know that there's been a lot of concern with various side effects. Would you like to cover the side effects and typical reactions that would be expected from the vaccine?
Sure. So the typical side effects is what Dr. Trivedi was just saying is usually they're mild side effects with the localized like pain and swelling. There is obviously a small chance that it could cause an allergic reaction similar to other vaccines. So if they do cause allergic reaction, it's generally within minutes after receiving the injection, which is why everyone is monitored for 15 minutes after receiving the injection. Some of the signs of a severe allergic reaction are difficulty breathing, swelling of your face and throat, generalized body rash like hives, dizziness, weakness. So we can talk a little bit about a summary about the COVID vaccines for children. As we mentioned, it is 91% effective, which is excellent in preventing COVID-19 infection among children in this age range from 5 to 11. In the trials, majority of the side effects were mild, self-limiting, very similar to the adults, what they've seen with those side effects, as well as side effects of other vaccines. It's very similar. The most common side effect was a sore arm. And as we have seen, there's been a lot of money and research put into this. So it is going to be continued to have a very intensive safety monitoring from here on out. So if we want to talk a little bit about how do they produce these vaccines so quickly. So as Dr. Trivedi said, a lot of these technologies have been around for decades and used in other areas of medicine. And so it wasn't like it was a brand new technology. It's just one of the more, I guess, recent technologies that was applied to produce vaccines. So with the focus on, it being a pandemic, once the genome was posted in January of 2020, everyone got to work. Vaccine manufacturers got to work. People are starting getting to work as far as like therapies for this. And, not just our government, but, worldwide resources were just prioritizing in developing vaccines and treatment for this disease. Everything that has been in place previously for other vaccines, as far as safety requirements, principles of scientific design, were all followed. There was no shortcuts ever taken. Approvals were just fast tracked instead of having them wait through a long process. Everything was just basically expedited once the evidence was in from these clinical trials. So there's always going to be questions as far as any long-term effects of vaccine. So obviously the safety data for both adults and children is ongoing as far as long-term safety data. Historically, with all previous vaccines, not just this vaccine, the majority of the side effects that occur after a vaccine happens within the first 6 weeks of receiving a vaccine dose. And the FDA, before it actually authorizes any sort of emergency authorization, has to study any of the safety data for at least 2 months after the final dose before there's any sort of authorization. And just a little highlight on, if you wanted to go back on the flu.
All right, skip the slide. We'll do this and then we'll go to the flu.
Okay. So there is going to be the question, what if your child already had COVID? It's the same recommendation as we have for adults. The recommendation is still to get vaccinated. No one knows for sure how long natural immunity is going to last if you had natural COVID infection. And so we're still recommending that everyone, whether you've had it before or not, to get vaccinated, children and adults. Research also suggests that those who have had COVID-19 infection in the past and then received the vaccines produce very high levels of antibodies which would suggest that you have an even increased immunity to it. So some scientists are calling this more of a hybrid immunity, so you're getting both the immunity from the natural infection as well as the vaccination. All right, so just a plug that there's other respiratory viruses that exist besides COVID-19, and that we are, what we would consider traditionally the flu season is that we want to get vaccinated against the flu. Certainly as a pediatrician, we see kids who can be very ill and hospitalized from the flu. So flu is also a contagious respiratory disease that can lead to serious illness and hospitalization and occasionally death. And the best way to protect everyone is to get a flu vaccine. The recommendation is for everyone 6 months and older to get an annual flu vaccine, and you can get both vaccines at the same time. So you can be vaccinated against both COVID and the flu.
So that's the end of our prepared information. So at this time, we want to turn it over for the questions that you all may have.
I know there were some questions that were submitted in advance. Let me pull them up so I can go through a couple of them. Well, you did address a lot of them, of the concerns and questions that people had, in regards to side effects and how long they take and the long-term risks. People are still asking about long-term fertility and safety effects. There was something a long time ago that went to adults that was published, but Dr. Trivedi, I think you addressed that in our initial, that there hasn't been any real studies that pointed to that. Is that still accurate with the COVID vaccine for children?
That's absolutely correct. I know that's been a concern of a lot of parents as well regarding fertility in their children. And this was kind of a rumor perpetuated, unfortunately, through social media using very old information and then kind of misconstruing that. And that kind of spread very quickly. Currently, that is not the case at all. The vaccine does not cause infertility or sterility. It doesn't affect fertility as far as getting pregnant, doesn't affect individuals who are pregnant and issues with their babies as well. So completely false. There's no issue as far as infertility is concerned. And as a matter of fact, they've done more research now because they have a lot more information proving that point much more concrete. So certainly not an issue at all.
Oh, excellent. Good. I'm glad to hear that. Yeah, I do remember that circulating on social media a lot. Question in regards to COVID vaccine based on a child's weight. I believe the dose it's a third of the adult dose, but I'll use my kids as an example. My son's going to be 9. He's a little on the small side. My daughter's 11. She's significantly larger than him. How did they come up with that, or why isn't it based on their weight?
So it's actually based on immune response. They tweak the dose to get an adequate immune response from children. Children have different immune systems than adults. They tend to have a much more responsive, robust immune system than adults. So this dose was shown to produce the same amount of neutralizing antibodies as adults, but it's really based on the development of the immune system, not an individual's weight. Dr. Ma, did you want to extrapolate it all on that?
No, I was just going to say exactly what you said, and,
Okay.
and obviously they're starting to look at research as far as like giving the vaccines for children then under the age of 5, and it's similarly that's the goal, is like what dose will produce a robust immune response, and whether it's going to be different than the dose that's recommended from 5 to 11 or those for 12 and above. That's what happens, with other vaccines. There's sometimes different doses or different booster schedule. For example, for like the flu vaccine, like the very first year you get it is slightly different than subsequent years that you get it. It's based on the immune response.
Excellent. I'm going to jump back. Somebody just posted a question in regards to the fertility question again. Read that there's no evidence that the vaccine impacts fertility, but there haven't been any studies that refute it either, at least that she's aware of. Have there specifically been studies regarding the impact on fertility? If so, over what period of time?
So the impact of the vaccine on fertility does not meet biologic plausibility standards. There is no biologic methodology for the mRNA vaccine where the mRNA disintegrates very rapidly in your body after it codes for the spike protein for that to go and cause infertility. As Dr. Ma and Dr. Trivedi both mentioned, the side effects for vaccines are usually within the first day or so, potentially up to 6 weeks. All of the clinical trials monitored effects for 2 months to make sure that they're looking at potential side effects as long-term as side effects would be expected. But long-term, there is no residual from the vaccine in an individual's body, so it would not be plausible that that would have any effect on long-term fertility.
Thank you. We addressed children that may have antibodies. This is a good one. My child is 11, going to be turning 12, in the next couple months. Should I wait for the adult vaccine dose or should I get them vaccinated now?
I think the best thing to do in those circumstances is to get them vaccinated as soon as possible. They'll develop antibodies and an immune response. Those dosings from 12 and 11, they're off by a little bit, but the immune response is quite comparable in that regard. Really what the dosing is concerned about is when you get to the younger ages, will it produce an adequate response? But the goal is to get vaccinated as soon as possible to help prevent that spread and potentially prevent long haul symptoms.
And when you talk about spread vaccinated, I was confused by a study from some time ago about how much an individual that's vaccinated sheds the virus. If you're vaccinated, do you shed the virus less than if you're unvaccinated?
So no, and this was like initially what we thought when prior to the Delta variant. And I think that's when we may have spoken about this. The Delta variant really changed the game for us as far as from an infection prevention perspective. It was quite a aggressive virus as far as replication is concerned. Prior to this Delta variant, you would be correct. You wouldn't be able to shed as much. You may not even contract it at all. And this vaccine was seen as almost like a shield, a bulletproof vest, so to speak. Since the Delta variant, the Delta variant replicates quite rapidly in the body, and because of that, you get a very large viral response, and because of that, you're able to kind of it's like circumvent the neutralizing antibodies, and then able to pass that along equally as if you were unvaccinated. The key here is that you're less likely to get infected, but once the virus has a vector and once it's able to get into your cells and replicate, it's very similar to those individuals who are not.
Understood. Now, do you anticipate a booster shot for children? And if so, is that similar to adults, maybe 6 months after?
Yeah, I mean, just kind of following the science right now, I do suspect that there may be a booster involved. We always hope that there's not going to be more variants. There are variants of interest in other countries right now that we're keeping a close eye on. So you do anticipate at some point that immunity may wane. What we're finding with the adults is that roughly around 6-month mark, you're seeing antibodies wane and people getting breakthrough infections. I anticipate similarly with children, although it may be a little bit longer because, as Gemma and Dr. Ma mentioned, that children's immune responses are quite robust and they may have a longer lasting immunity than adults do. But it's still hard to tell. Right now, we do know that it's very effective for children as far as vaccinations are concerned, and hoping that those last quite some time.
Well, that's good news. And then what if your child wakes up and has a runny nose, maybe some congestion, and is scheduled for the shot? Do you still go forward with the shot? Should the child get tested? Is it a potential symptom of COVID before the shot? What are your recommendations for that?
Well, I would say that you can't really tell whether the child's actually having COVID or another one of a whole bunch of different respiratory illnesses. So, generally you're not supposed to try to get vaccinated when you have an active COVID infection. So yeah, I would say, the testing is available enough in general to be able to go and get tested and make sure you don't have COVID, and it might be just a different other respiratory virus, but the symptoms overlap a lot with a whole bunch of other things that are going on at this time. That's what I'm just seeing, since I work in the emergency room. Every day I'm there. There's kids who are all coming in, sent in by the schools to get COVID tested. So it is very difficult to tell sometimes in children, whether it's COVID or it's RSV or it's flu or it's a number of other respiratory viruses that are out there.
And Dr. Ma, the most effective test again is the PCR test, correct?
It is, but I would, the rapid antigen test is pretty accurate. And I think it's going to be sufficient for majority of the time. I know that depending on where you're trying to get the test, I mean, the rapid test sometimes is more readily available, has quicker results. There are places that if you're trying to get the PCR test, that the turnaround time may be a day or two. And unfortunately, when the turnaround time is longer, then that's sort of delaying if you need to be under isolation.
No, understood. I had to take a PCR test recently for an upper respiratory infection, and it took 4 days to get the results back. So
right.
Which is unusual. It
is unusual, but it depends on where you're going to get tested. So, I think that if kids are trying to get back into try not to miss school or get back to an activity, sometimes it's just, you're going to get the test or whatever is available. And sometimes the rapid antigen is easier or more widely available sometimes than the PCR test is.
What are your thoughts on the home test?
Well, I think that if you do, it's pretty easy. I've done a home test on myself.
Me too.
So it's really not that bad, So and I think if you want to do a home test, sometimes a child might be able to tolerate having their parent actually physically do the swab a little bit better than when they're in a situation at a physician's office or a clinic or a hospital of doing the swab. So I think that if you're following following the directions and doing the swab, it can be pretty accurate.
So the home tests are definitely really good when you're symptomatic. Antigen tends to be positive when you're symptomatic. There has been a recall though on the Ellume home tests, which were the ones that were really sold by Walmart, CVS, Target that tend to be out there. So we definitely would encourage anyone that has the Ellume antigen home test to make sure that they don't have one of the affected lots because they're all testing positive. And it's always good to follow up a questionable antigen result with a PCR. So if you are symptomatic, but your antigen test is negative, but you still, you have loss of taste and smell, you think you might have COVID, follow that up with a PCR. Likewise, if your antigen test potentially is a false positive, a PCR can be your confirmatory test. But those home tests are really great to determine kind of right off the bat, as long as you don't have the recalled one.
No, it's good. It's good information. We'll make sure we push that out. And then are they discontinuing the current PCR test in December and implementing something new? I haven't heard that. Have you?
No, I haven't heard that either. I know that they are having different PCR tests available. Some are more rapid, especially in the commercial setting, that they're going to try to, as you said, waiting 4 days is really cumbersome. So I think they're making it more available. But as far as the current one, no, they're not discontinuing that.
Okay. And then is the vaccine safe for children with peanut or tree nut allergies?
Right. So from a components perspective, the vaccine doesn't have any interactions, the Pfizer vaccine, to peanut allergies or any types of tree nuts or pine nuts at all. Really the component, if you have an allergic reaction to the components of that vaccine, you should be concerned. And that really it's a lipid kind of molecule. It's very rare to have an allergic reaction to that, but some individuals do. Children, it's really difficult to kind of tease that allergy out. A lot of adults, for instance, there's different kinds of stool softeners, for instance, if you have a reaction to that may be a component. But other than that, it's very, very safe, especially to food allergies.
Good news. How about the COVID vaccine for children who already have disabilities, like autism, for example?
Right. So, as far as for disabilities is concerned, they would be considered as immunocompetent individuals. And so you would still want to vaccinate everybody. And there's no side effects as far as any kind of disabilities in that regard. There's really the same kind of profile that Dr. Ma outlined for us in our presentation as far as side effects are concerned. Really the sore arm, low-grade fever, sometimes up to 24 hours. Some individuals get some nausea. but there's no additional concerns that one would have to consider in any of those types of disabilities at all.
And certainly, if you have any sort of any child with a chronic medical condition or at risk for being immunocompromised, the recommendation is to get vaccinated, because you don't want to potentially have a severe life-threatening COVID infection on top of a chronic medical condition.
And then as parents, how do they verify that their children are receiving the correct dosage of the vaccine? There's not an error by accident.
So Pfizer actually labeled their pediatric vaccine, the dilute version of their vaccine, slightly different. You want to look for an orange label. So as we showed the slide, it's in the slides, we did the actual picture of what you want to look like. So I know when I brought my children to CVS this Monday, and they had a nurse there and they were doing vaccines for 90-year-olds and they're doing vaccines for children, I made sure when she drew up the vaccine that the vial had the orange label on it, because that's the pediatric version.
Excellent. I did not know that. So it's good to know.
It's purple for adults, orange for children.
And now let's see here. My understanding is that this shot impacts the quote unquote proteins in the body. My child has had issues with high levels of proteins, possibly MOG, which caused her body to quote unquote attack her optic nerve, causing optic neuritis. Does this shot impact those same proteins?
No. So how the shot really works is the messenger RNA is basically like a blueprint. And so this blueprint is put into these little fat molecules that make up the vaccine. When you inject the vaccine into the body, these fat molecules allow this blueprint to transfer into the cell. The cell takes that blueprint, looks at it, interprets it, and creates its own, what we call a spike protein. These spike proteins are different. The spike protein is basically almost like a way to distinguish itself from other cells. It creates almost like little flags on the top of its the surface that allows your immune system to recognize that this is something foreign. And your immune system then develops antibodies against those cells so that it can recognize that this could potentially be a problem. That blueprint and all of the components of the vaccine disintegrate rather quickly in the cell. They never make it to anywhere else in your body, and they dissolve. Those spike protein cells circulate through the body, signaling off to tell your immune system, hey, we need to create antibodies for this, as they go and they live their lives out, basically almost up to 180 days. Once those cells die off, you don't have any more spike proteins in your system. But what you have lasting is those antibody responses, your army cells, so to speak, who recognize that maybe these spike proteins could be foreign. Those spike proteins mimic what is on a COVID-19 virus. And so once it recognizes that this is foreign, if you were to get get contact with COVID-19, for instance, these antibodies would respond and then neutralize that virus very quickly.
Then I'm only seeing one other question that we have here to wrap it up, but it's more overall arching as to where we're going with COVID. Right now we're seeing cases increase in the northern states, Montana, Michigan, Minnesota, where it's tend to spiking significantly more than what you're seeing here. There are, 80 cases per 100,000 where we're 22, which is significant. It's like you said earlier during the presentation, it is that season for COVID, and people are generally moving more indoors. With the holiday season coming up and gatherings happening indoors, what tips can you give us so we can stay and provide safe environments for our families and friends?
Well, it's always safer to be outdoors when possible. If you're getting together with multiple different people from different households that might have different vaccination statuses, try to have a bonfire, try to do something outside whenever possible. If you are going to have gatherings inside, try to increase your ventilation. The latest studies are really showing that ventilation indoors is one of the biggest impacts on spread. So open windows, have portable air scrubbing units, wear masks when inside, whether you're vaccinated or unvaccinated, when in group settings. Try to ensure, obviously, hand hygiene and respiratory etiquette, the normal stuff that stops flu and other cold viruses from spreading, but really try to be outside as much as possible.
Yeah, it seems that density, duration, and airflow are still three of the biggest factors in spread of COVID.
That's right.
No. I do not see any other questions in the room, and we've gone through all the questions that have been asked in advance. I want to thank you certainly for your leadership through this whole process. We've worked very closely together through the pandemic so we can provide information to the Chamber's business community and the community in general. So wonderful information today. Are you able to share the PowerPoint slide that you presented today?
Absolutely.
And then I'll email that out to everyone that registered as well.
Great.
So thank you so much, Dr. Trivedi, Dr. Ma, Gemma, thank you so much for your time today. Great information. I hope this eases some of our parents and caregivers' concerns with the vaccine, as it is a real difference maker in keeping people safe and healthy. So greatly, greatly appreciate it.
Thank you.
Thank you for the.
Thank you for having us.
Thank you, everyone. Be well. Happy holidays. Have a happy Thanksgiving if I don't talk to you guys. Enjoy the holidays.
Cheers, thank
Yes,
you.
happy holidays.
Take care.